So I would like to give a warm welcome to Nikki Harris, serves as an assistant professor and the director of student recruitment for the Department of Athletic Training at A.T. Still University. Dr. Harris brings a wealth of clinical experience to her department, previously working with underserved populations in the secondary school, collegiate, and clinical practice settings. Nikki actively engages in professional service at all levels, most notably as the current chair of the NATA Career Advancement Committee and the chair for the educators subgroup of the NATA Athletic Training Compensation Task Force. Dr. Harris values the effects of research on practice and education and has demonstrated a commitment to the satisfaction, advancement, and retention of athletic trainers through her scholarly works. She has been great with us in the IATS. She's a huge supporter, and she presented last year, and we're excited to have her presenting this year.
Awesome. Well, thanks for the warm welcome. I'm sorry this isn't the sexiest of all topics. I don't know how much people love. I don't know that they love talking about continuing education more than they love doing continuing education. But it seems like this conference is a fun one. So we will kick it off just a little bit. I know she read my bio, but a little bit about me. I am definitely the eternal learner, lifelong learner. I keep going back to school. I keep continuing my education. And as the chair of the Career Advancement Committee, I've become very passionate about career advancement in terms of, how do we just continue to advance our profession as well as ourselves within the profession to keep seeing how much we can do as athletic trainers. So part of the reason why I'm speaking on that today is to kind of share a little bit that passion with you and get an idea of what that looks like for individuals in the industrial setting. I feel like I've worked in a variety of settings now. I cannot lie. I have not worked in the industrial setting, but I do think there are certain things about the industrial setting that mirror some of the things that I've worked with. So this is a CEU presentation, but it is also meant to be casual. So we will have a few times to open up for conversation. If there's any questions, I cannot see you raise your hand, but I'm counting on Tiff to help me with that. All right, so objectives for today. First is to describe the unique continuing education and professional development need of an industrial athletic trainers. We will illustrate the areas of continuing education that could be beneficial to ATs that are practicing in industrial settings. We will illuminate some of the post-professional educational pathways that exist in athletic training right now, and kind of open up the floor to talk about how gaining proficiency and upskilling in those areas might help you in your advancement as an athletic trainer, particularly within the industrial setting. And then lastly, I will stand on my soapbox for a little bit and advocate for you guys to start producing continuing education through whatever method is best for you all so that we can increase the knowledge about the industrial setting, because I think that is ultimately the most important goal today. So we'll talk a little bit, and I always like to start with the Dreyfus model. If you guys don't know, I work at A.T. Still University. My former boss and mentor is Eric Sowers, and he is a big fan of educational advancement. So he's been really instrumental in creating the DAT and pushing for athletic training education. So the Dreyfus model is a model that essentially says that it actually wasn't built originally for medicine. It was built for other fields, and we've kind of adapted it to medicine, but it fits very nicely here. So essentially the Dreyfus model looks at saying that each clinician has a range of experience, and everybody, if we think back to when we first went through our professional programs, regardless of what route you took to certification, we all at some point started as these novice athletic training students that really didn't know anything, right? We needed explicit instructions to do anything. We needed explicit instructions on how to make the Gatorade and how to tape an ankle and how to evaluate a shoulder, right? We could not do that without some serious mentorship, without the textbook to lead us through one by one, right? And if the situation changed, right, if I'm evaluating shoulder at one point and then I evaluate acute shoulder injury or a dislocation, and then all of a sudden I'm evaluating a chronic shoulder injury, right, the situation has changed, and at that point I'm going to need more instruction on how to get through this. So I went to an entry-level master's program, even though I'm a little old. So I think of first years and second years, right? So as a novice, you're like that first year student that doesn't know anything. And then eventually things start to click, right? You go through all of your evaluation classes, your rehab classes, and you're starting to get like the basis of things. So at that point, we kind of consider you an advanced beginner, right? There's some things that you can do now on your own. Most of the time, you can get through an evaluation and you can get some type of diagnosis with differentials without assistance. But again, your situational perception is still limited, right? So we need to walk through things when they occur in a different order or perhaps have different signs or symptoms. We still need a little bit of help to get us there. Eventually, we get to the stage of competency, and that's really where I think of as us taking the BOC exam, right? So I assume all of us here, we are BOC certified, right? In whatever format we took the exam, we had to take a test that essentially said that we were competent in practicing. And really what that means is we're not going to kill anybody, most likely, right? They can trust us for the most part to do the basic clinical skills without putting anybody at harm, at risk, right? So for the most part, we're here, we're confident with most of our decisions, but I think we can all agree that we're absolutely still learning, right? We're competent, but we are by no means an expert in really anything at that point. We are just existing, right? And that's kind of where I want to stop, right? I know we all have different levels of experience here and different time practicing. However, we think of that BOC as the starting point of us becoming competent. And we'll talk a little bit more today about how you guys can start to push yourselves into these proficient and expert ranges. But right now, we're just going to assume baseline competence, right? So we look at that BOC, and this is essentially a start line. I think we think of it as a marathon, and we're running through school, and then we get to the finish line, we pass the BOC, we get a job, and then we all pass out and look like those people at the marathon, you know, that are tired with their cold blankets on, right? But in reality, we have to acknowledge that there's a long way to go, particularly if we are going into some of these emergent settings, such as the industrial setting, that we really didn't necessarily learn that much in school about, right? So we have to start to consider what we want our continuing education to look like and how we're going to get to those proficient and expert levels. So the goal today is to reflect a little bit more about being intentional with what we do once we hit that competency phase. So I want to, I didn't have this as a formal poll, but I do kind of want to open it up to you guys. So feel free to unmute yourself. You don't have to turn on or off your camera, but you can just speak. But there's these three terms that kind of float around when we talk about competency and renewing our certification and our licensure. And we have maintenance of competence, we have continuing education, and then we have professional development. I'm curious as to how you guys would define this. So I think for the most part, we understand maintenance of competence, but how might you define continuing education, if anybody wants to speak? Y'all sleep already?
So I'll open it up since I am on my second cup of coffee of the day.
Absolutely.
So continuing education is, kind of taking sort of like that learning every day kind of thing, and just keeping your certification for one thing, but also developing your skills.
Okay. And how do you think that differs from professional development? I'm putting you on the spot.
Professional development, I would say, is sort of building those like new skills rather than the skills you already have. I mean, I guess both of them can kind of fit in that category, but that's going to help you better. You really did put me on the spot.
It's hard. No, it's a
I'm in the middle of my second cup of coffee.
I wanted everybody to think about it because it's really, these terms overlap a lot, right? So it's hard to kind of delineate them from one another, and that's okay. I didn't expect anybody to have a clear answer, so you did great. So we'll talk a little bit, right? You may see the term, we'll talk about continuing education first, because when we think of those in a hierarchy, traditionally continuing education is going to be at the lower end of that. So some people may call it continuing medical education. In athletic training, we've pretty much taken that down to CE or CEU. And when we talk about continuing education, this is a term that's really used in medicine and healthcare, and it's intended to focus on clinical domains, right? So when we think of the domains of of athletic training practice, for the most part, when you see CEU generating presentations, they're usually going to be focused on clinical topics, right? Whether it be risk reduction, injury prevention, evaluation, rehab, therapeutic interventions. They're usually going to be focused in those clinical domains. And for the most part, when we talk about continuing education, I got a typo, sorry. When we talk about continuing education, we're really going to be talking about that maintenance of competence, right? So we talked about we're getting to that competent level, and then we are maintaining that competence. But we have to understand that the bar for competence changes over time, right? And specifically, I'm now in my 11th year of the profession. Oh, don't look at my grades. You can see that the things have changed, right? The KD standards changed in 2020, and there are a lot of things that are included in those that were not included when I graduated in athletic training in 2012. So I still need to know those things to be a competently practicing physician. So in some cases, continuing education may include bringing clinicians up to speed on things that are considered current practice. But for the most part, we're just maintaining that competency, right? For some individuals, for example, I taught a class this week on whole person healthcare, right? So social determinants of health were not something that I learned when I was in school, but they are now included to some extent in the KD standards, right? So I had to bring myself up on that term in order to maintain competency there. So for me, that's new skill, right? I'm essentially upskilling myself because I'm learning something that's brand new to me. However, as an athletic trainer, as a certified athletic trainer, I am now just maintaining competence. So then we move on and we think about professional development, and we hear that term a whole lot too, right? Really, it comes from the term CPD, which is continuous professional development, and that really emphasizes the fact that professional development, kind of like you spoke to, is something that's a lifelong learning, right? At this point, you're starting to upskill, I like to call it, or you're getting to those areas to be more proficient or become even an expert in a certain area, right? And professional development, usually when we talk about continuing education, we're talking about more formal things versus professional development. A lot of times for professional development, we may do things like soft skills, right? We may take things that go on to interdisciplinary collaboration or communication in the workplace. We're going to start to add in some of those soft skills, and it won't just be formal lecturing or things like that. We're going to talk about all the activities that we do, whether that's our personal reading, whether that's watching of videos, whether it's webinars, whether it's going to conferences, whether it be getting new certifications. It's a much broader term that we use to talk about really developing ourselves rather than maintaining our confidence. So that is what we want to strive for. And the one thing I want to point out about professional development too, it really emphasizes behavior change. So when we learn something through professional development or continuing education, professional development really works on how do we now implement that new knowledge into our practice or into work, right? So it really kind of comes full circle and makes sure that the knowledge that we have is actually implemented versus just, taking the quiz and moving on. So just for like a visual of this a little bit, this is the AT milestones, which is something that we use a lot at AT still, but it is published across for all athletic trainers, and it uses that same skill, right, of novice, advanced beginner, competent, proficient, expert. So when we look at continuing education, we are maintaining competence, right? So as we go through levels, we're essentially just making sure that we're staying at the competent level over time. When we look at professional development, we are now moving intentionally up the spectrum towards being aspirational. And I talk a lot about self-actualization. So people are driven by a desire to want to achieve, to be smarter, to make changes in their environment. And that's really when we say what we say we want when we say we want aspirational, right? So we're moving our professional development towards those aspirations that we have personally and professionally. So I'm opening it up this time, and Tiff can't be the only one to answer me. So we're going to have a quick poll, and I want to ask everyone in the audience, upon entering the industrial setting, regardless of, think back to when you first started in industrial, how prepared were you to care for industrial patients or industrial workers? I'm curious to see what that poll says. I don't know if I can
So
see.
I believe to answer the poll, if you look in the bottom right side of your screen, you'll see some shapes there. Click on that, click on polls. That poll should be live.
I got no shapes. I think it's because I'm sharing my screen. I'm only sharing my PowerPoint screen. Oh, yeah.
It's the activities tab.
Yeah, got it.
Nicola, I'll take that one. And I don't know if you saw my chat. I'm out here kind of working a soccer event, so I'm kind of doing one of these on the down.
I don't know how to access it on mobile, but if you have a activities tab on there somewhere, it's a bunch of shapes. Just click on that, click on polls, and you should be able to answer it.
Yeah, I got 3 votes so far. I know there's more than 3 of you out there. Almost. I'll give it another couple seconds. All right. They can see the answers too, right?
Yep, everybody should be able to do that. Oh, maybe not. There we go.
All right. For those of you in there, we kind of have a bit of an even split. We got 50%. Oh, not an even split. So more not prepared. Which is what I would have expected. So last year at the conference, we sent out a survey to individuals and had them answer that question. So we'll talk a little bit about their answers last year for the large group, but that helps too. So I want you to answer your next poll question, which is going to be, if you lacked preparedness, how did you gain the education needed to adequately perform in your role? So there should be a poll for that one too. Self-taught, we got professional development or continuing education in athletic training. Cool. All right, so let's talk about some things. So last year, like I said, we sent this out. We actually got most of the people at the conference last year to fill out the survey. Some of them we couldn't include in the data here, but we basically asked industrial athletic trainers, how did I skip one? No. How did they get the knowledge needed to effectively practice in the industrial setting? So only 1.5, literally one person out of 67 said that they got that knowledge as part of their professional program. So the level in which they were competent, right? They went through their professional program, they graduated the BOC. One person said that they knew how to treat industrial patients before coming into the industrial setting. And I think that's a bit concerning, right? When we think about professional education, but it also emphasizes the importance of continuing education and professional development. So kind of in line with the poll we just took, 23 or 24% of people will say reported being self-taught, or that they essentially learned on the fly or learned on the job, right? So not too surprised about that. And that seems in line with some of the individuals in the audience today. So 67.2%, so the majority of people that answered reported that the knowledge and skills that they needed to care for industrial patients was gained from their employer directly, right? So they took some type of training from their employer that taught them essentially the needs of the patients, who they were treating, what they're going to be doing, and the skills that they really needed to practice in that particular setting. And I don't necessarily think that it's a bad thing, but I definitely think we have some room for improvement in regards to showing people what happens in the industrial setting and then preparing them for that practice prior to kind of learning on the fly on the job. Just thinking about how much better our care could be if we were well prepared for that in a more formal manner than only through our employers. So when we think about industrial athletic trainers, we know that there's a ton of industry. I don't, Susan can probably tell me, but I think we had at least like 14 different types of industry that you guys are working in across the survey. So obviously things are going to vary depending on the sector that you work in, but for the most part, the research shows that things that industrial athletic trainers need to know are the ability to recognize safety issues, conduct ergonomic assessment for both static and dynamic activities, fit personal protective equipment, and I think that is, again, setting specific as well. Communicate critical and non-critical workplace incidents, administer functional capacity examinations, and then abide by OSHA guidelines, which you'll see was a big thing when we asked you guys what you were doing specifically. So part of the survey from last year also asked you, what skills did you feel like were most valuable to the industrial athletic trainer? So when you were thinking about continuing education that you would have liked to have to prepare you and or that you need moving forward, there was a lot of consistency between respondents. So across settings, 76% of individuals indicated that they would have liked or needed some continuing education in ergonomics. 56%, almost 57% said OSHA or some type of occupational health. What I think was important, and it's just a quote that we pulled out from participants last time, is that participants referred to specific regulations that were set forth by OSHA. Then they really felt that they limited the athletic trainer's scope of practice, as well as restricted how or when that they could perform certain services, including things like first aid and rehabilitation, as well as documentation. So we'll talk a little bit more about that later. Other things that were rated as important: organization, administration, and leadership. Manual therapy, which was a little surprising to me, so I'd love to learn things about the industrial setting. Aging populations was not so common in the quantitative stuff, but people did mention the need to understand comorbidities and aging populations in the qualitative responses. And then we did hear a lot about chronic and overuse injuries, which I am also surprised was not a larger theme, but again, learning so much about your population as well. So essentially kind of keeping all that in mind in terms of what the research says, in terms of what you guys reported, I want to talk a little bit about how you select your continuing education opportunities. So according to the research across fields, obligation is really not a motivating factor in how people select CEU opportunities. And that makes me really happy to hear, because I think every time when reporting cycle comes around, we hear all these people of like, where can I get CEUs? I need CEUs. I need 4 more CEUs. And they just start doing anything that's free so that they don't have to pay for it. But when people actually have the opportunity to talk about what motivates them in continuing education, most of the time it is not the obligation to just do it in general. Rather, it's always been associated with your patient population. So ATs assume kind of a clinician-centered approach, and they choose their continuing education usually by either what they feel weak in their own practice, or what they perceive their patient to need. And that may count to be what their patient population is, what types of injuries that they're seeing in their practice, et cetera. So that is really comforting to hear that we recognize our weaknesses and that we try to overcome those, as well as we recognize what our patients need, and that we're really trying to provide patient-centered care. So relevancy continues to be ultimately the biggest influence in why we should be choosing our continuing education opportunities. So we'll talk a little bit about how to get those opportunities now. And I'm going to run through some of this quickly, not to be assumptive, but I think some of it applies to most of you if you're planning on staying in the industrial setting for at least a little while. I think it applies to you more than others. So feel free to ask questions after if there's something that I didn't touch on. So for the most part, when we think about ATs in general and we think about the maintenance of certification, most of us are going to subscribe to some type of traditional method of getting our CEUs, right? So we're going to attend a conference. Obviously, we love how do you pronounce your acronym? Can I call it it's not, I want to call it IATS, but I can't. No, never mind. Industrial Athletic Training Society. We love your conference, but most people are going to get it from attending a conference, whether it's state, regional, setting specific. They may do some type of home study course, or they may attend a webinar of some sort that is not necessarily a conference, but it provides some type of approved CEU. So those are like the most traditional methods that we're all probably going to use for some subset of our CEUs. So when we want to maintain our certification, the BOC is actually trying to do a really good job with this, of offering people some more non-traditional opportunities. They're a little bit more impactful for them to gain CEUs. So some of you guys may have heard of these in passing. Some of you may have participated in some of these, I hope. But I just want to touch on them briefly so that you guys know that they're out there. So the BOC offers 4 opportunities now to gain CEUs aside from the traditional methods. One of them is going to be the competence assessment modules. So these are meant to strengthen your clinical expertise in a particular area. And you basically go through and review literature for these. You're going to do a short module and then you'll take a quiz. They are off right now. I think they're in cultural literacy and mental health are the 2 topics that they have, and they're continuing to add more of those. They also have the professional goal appraisal, the PGA, which is meant to evaluate what your needs are. And then you're going to self-set goals based on what your needs are. And you're going to work to enhance your clinical practice and knowledge. So essentially, you're going to have to earn your CEUs in a particular topic in which you evaluate that you need and that you have set a goal for to improve. So these are really great at keep holding yourself accountable to what you foresee to be your weaknesses, and then ensuring that your continuing education falls within the areas that you said that you are weak. So these are kind of tricky. I will say I did one of these ones and I did it and I thought it was cool. And then I got to reporting time and I realized that I didn't have enough CEUs in the areas that I said I was weak in. And I had to intentionally kind of seek out opportunities there before I could renew my certification. So it absolutely holds yourself accountable, but I will say it was great. It was really awesome to be able to essentially evaluate that and then structure a plan based on what I objectively needed and not just what I felt like was interesting or needed otherwise. So there is another opportunity called the quality improvement projects. These have gotten a bit of press in the BOC as well, but these are great. And I think this is a great option for industrial athletic trainers based on the way that industry works and their desire for continuous quality improvement. I think this is an awesome way to earn CEUs, and you also get 10 CEUs for enhancing that. So that's a good number of CEUs. I think they charge you $60 if I'm not mistaken, but honestly, it's a great use of funds. These are going to require you to implement a project within your setting that's going to help to enhance patient-centered care or the system of health through which you provide. Right now, their most common one is hand washing. So essentially, you are going to come up with a plan to increase hand washing in your setting. You're going to implement that plan. You're going to kind of study what happened as a result of that, and then you're going to take some action there. And you'll document that process within like a standardized template that occurs in the BOC. And then you earn your CEUs that way. So a great way to make a difference in your clinical practice setting, again, and hold yourself accountable to improving that system. So lastly, I'll talk about the professional development needs assessment. So this is similar to the one I talked about. So this one is interesting. There's a QR code here if you guys are able to scan it, and I sent the link out as well. That'll take you directly to assessment. So for lack of a better way to put this, this is essentially going to be like taking the BOC exam now. It is not exactly the BOC exam, but it is a rather long assessment that is going to give you questions across the domains of athletic training. And then if you guys remember the practice exams that you took for the BOC, where it kind of ranked you by domain to tell you where you needed to work on, it is essentially going to do that for you now as a practicing clinician. And I will tell you that, again, this like threw me for a loop. When I think of my expertise, I always think of orthopedic evaluation and rehab, and those were like my lowest category. So I was legit like mad for a minute. But again, it gives us an opportunity to objectively assess ourselves and kind of force ourselves to grow in areas that perhaps we perceive ourselves to be better in than what we are. So essentially, it's going to hold us accountable to mapping a plan for professional development. It's going to help us identify those learning needs. And I think this is particularly good when you're taking on a new position and or you're changing practice settings, right? So this would be a really good opportunity to do this before entering the industrial setting to see kind of what you need to work on. And then that way you're working on that to improve as you enter, you know, again, a new position or a new employer. Also, some people take breaks from practice, whether that be because they go into a non-clinical setting or because, you know, they retire from athletic training for a while and come back. This is a great opportunity for you to, again, we talk about competence, the line of competence moving based on the competencies. So this is going to allow you to assess that as well. So highly encourage you guys to do that. Like I said, be cognizant. You're going to have to hold yourself accountable, but I think it's an excellent tool. And again, it's going to allow you to earn 10 category B CEUs. So you're 1/5 of the way there just by holding yourself accountable there. So awesome option. So we talked about all those, and I highly support all those. I think for any athletic trainer in any setting, those are great options for you to work on maintaining your competency. One of the things is that continuing education, from what we saw in the survey, is going to play a really vital role in supplying industrial athletic trainers with setting specific knowledge and skill that they need in order to ensure they're working effectively in the industrial setting, as well as being able to improve the outcomes of industrial workers. And the issue is that you guys have a very unique patient population compared to more traditional settings, right? And there's really an existing lack of research that represents the industrial patient. I mean, there's like, you can search the Journal of Athletic Training. I think 2 articles come up when we were writing the paper that are even related to the industrial setting at all. So this really limits how much CEU is going to be out there for you guys, right? If you're thinking about again, if relevancy is the reason why you're picking continuing education and there's nothing available that's relevant to the industrial setting, that's really challenging, right? At that point, you're just doing CEUs just to do CEUs so that you can stay an athletic trainer, or you guys are going to go get your continuing education in another field, whether it be engineering, whether it be health and safety, right? Because you want, ideally, you're going to pick the continuing education opportunity that is most relevant to you. So we got to get more industrial specific stuff, period. In addition to having the unique patient population, again, you guys have specialized knowledge and skills. So it's going to force you to choose between maintaining your certification and licensure or pursuing professional development in another discipline. Like I said, engineering, health and safety, because you're ideally going to want to fill those knowledge gaps. And you're going to want to be successful for your organization. So that leads me into my ploy for advocating. If an opportunity does not exist, I need you to create it. Most of you guys are early adopters, you're innovators, you've already gone into the industrial setting when many people haven't ventured there already. You've already created your own society. You've already had 2 successful conferences. So we know that you're early adopters and you guys are really the perfect group to create more industrial specific stuff, right? The better that we can promote the industrial setting, I think the better it is for all of you in your respective positions. So I just going to give my ploy to kill 2 birds at one time, right? So a lot of people don't know that, like, I'm now an academic, I guess you could say, because I work in higher education. People are like, oh, it's so boring. You're always presenting and doing articles. And yeah, it is. But I never, ever, ever have to do CEUs because it's some way I'm collaborating with somebody and I'm going to get them off the top. So killing 2 birds at one stone. If you give an oral presentation at a virtual or a live conference, so for example, I'm here talking to you right now, I get 10 CEUs for doing that. That's an hour of work. Yes, I had to prepare my presentation, right? But by able to deliver this, that's 10 CEUs off the top, whether or not it is certified for CEUs or not, right? So I'll get 10 category A or category B, depending on if the presentation is CEU granting, but that's 10 CEUs. If I'm a co-presenter, so somebody throws my name onto a presentation and I talk about a few slides, that's 5 CEUs right there. So thinking of industrial specific topics that you guys deal with every single day and doing a presentation at those here at the Industrial Athletic Training Society conference or really at any conference is going to allow you to get those CEUs. Same thing, poster presentation. Why do I have so many typos? I think I got Grammarly and it's driving my computer crazy. I'm sorry, y'all. Poster presentations, again, pretty easy. You don't even have to talk to people at that point. You're really just making a poster on Canva and presenting some knowledge that's specific to your setting. Again, that's going to get you 5 CEUs. Serving on a panel, those are some of my favorite conversational things. Serving on a panel is going to get you 5. Authoring an article is going to get you 15. And again, there is such a need for industrial specific research, and you guys do not have to do research alone. There are so many people, including myself, that are willing to collaborate with you at any point. We can't speak on your point of view because we don't live that life every day. So your biggest thing there is to reach out to a colleague and collaborate on any type of article. And that's an easy way for you to contribute to the knowledge base as well as earn yourself CEUs. The other way is serving as a preceptor. Again, I want to encourage you all, if you have your organization allows you to, and you have access to an athletic training program, to please serve as a preceptor, because we've acknowledged coming out of our professional programs, they aren't knowledgeable about the industrial setting, right? They aren't knowledgeable about it being a practice setting in order to advance their career, and or they aren't knowledgeable about how to be prepared to get there. So by you serving as a preceptor, that's going to exponentially increase the knowledge base about the industrial setting. And it's going to get you, for every 200 hours you precept, you get 5 CEUs per year. So within a reporting cycle, another great way to get 10 CEUs without doing too much work. Okay, so we talked a little bit about ways to kind of self-assess yourself and build a plan for professional development. I am going to talk a little bit about post-professional educational pathways. Again, I said I'm going to give you a kind of a condensed version. I think that applies to the industrial setting. Some of you may consider going back to further education, and some of you may be very happy where you're at, but I think it's important to just run through these options a little bit before we talk about the specific skills that may be good for you. So when we look at the current state of post-professional educational pathways, we have a number of different options. When we did the survey last year, I think there was over 80% of you that possessed a master's degree. A good amount of you got certified at the bachelor's level and did some sort of post-professional master's or GA during the traditional route. And then there's some individuals that stayed at the bachelor's level. So I think, if I'm not mistaken, there are currently 2 programs that still serve as post-professional masters, and these are really for individuals that got certified at the bachelor's level and are looking to kind of advance their athletic training specific education to the master's to kind of meet the entry-level master's requirement, and kind of be competitive in the field. They are clinical based, and they're meant to advance. They're really meant to help you transition to practice and advance your practice there. We do have residency programs, so these are not to be confused with fake residency programs or internships or any of those really low-paying things that you see on the NATA Career Center or Indeed. Residency programs are meant to build your practice in a particular specialty area, so we will talk more about that. And then we talk a little bit more about the doctoral programs, which are going to include the DAT, which is considered not a clinical doctorate, but an advanced practice doctorate, which is going to help you be an advanced practice leader within athletic training. And then ultimately the research doctorate, or the PhD that some people may be interested in. But both of these are focused more on administration and leadership within the profession, opposed to advancing your clinical practice. So we talked a little bit about the post-professional masters. This is fading away, so I won't spend too much time on there. Highly recommend that if you don't have a master's, you do that. The NATA's last stat said more than 70% of athletic trainers hold a master's degree. I do think that is true, if not higher at this point. So it's a good idea to have it, if none else, just to make yourself competitive in the market. They're designed to enhance students' knowledge, skills, and abilities beyond that level of competency and start moving you towards proficiency. These programs are no longer accredited, so there's no accredited post-professional master's program. CATE only accredits education at the professional level now, so master's degree programs as well as DAT programs are not technically accredited. So you do have to do your research on what you're getting into. Aims of these programs, again, advancing clinical practice. Many of them have a bit of a research component and scholarship component, and they're really meant to improve your patient care as well as your patient outcomes here. So a few options here. Again, I think there's 2 programs that remain for these programs. When we look at accredited residency programs, again, I won't talk about these too much because right now they don't have ones that are specific to the industrial setting. Again, these are not internships. They're not graduate assistants. Some people call residency programs as another fancy way for internship. But residency programs now have to be accredited by the CATE. So they accredit post-professional education as well as residency and fellowship programs. So essentially, these are mentor-driven programs, so you will be assigned a former mentor, and then you will be working in a clinical space to advance your skills in a particular area under mentorship from a physician or an individual that specializes in that area. Essentially, what is meant to happen is you do an accredited residency program, which most of them are 1-year positions, And then you have a path to pass the BOC specialty certification. You do not have to do a residency to take the BOC specialty certification. You also can take the BOC specialty certification under other pretenses. But residency programs are one-year positions. Usually the salary is about 2/3 of a full-time position. So I know a lot of the residency programs pay like 40. So not nearly as bad as some of the internships, but also still less than a full-time position because you are being mentored and not working in a full clinician role. These come in 8 different specialty areas. So prevention and wellness, urgent and emergent care, primary care, orthopedics, rehab, behavioral health, pediatrics, and performance enhancement. There are about 20 of them across the country right now. Primarily, there are 13 in ortho, 5 in rehab, 2 in pediatrics, and the other ones are still essentially being built. I don't know who's in a position to do this here, but prevention and wellness sounds like an amazing residency that could be completed potentially in an industrial setting. So I would love to see how those could be combined in the future. This is just a list of the residency programs in case that was something you were thinking about. I will, on this note, before I go on a tangent, I'm doing some research right now regarding individuals that went from the traditional setting to the physician practice setting. And it actually came up in some of the analysis of the interviews that there was one individual who works in the industrial setting now and said she did physician practice prior to that and talked about how much working with a physician in physician practice prepared her for working in the industrial setting. And I thought that was really interesting. She just talked about the nature of the population. Some of the things we talked about aging populations and comorbidities had really prepared her to be a better athletic trainer in the industrial setting. And I thought that was a really interesting career path and interesting to know. So it might be kind of cool to see somebody go to an accredited residency program and then end up in a industrial setting for practicing. I would love to see that. Okay, just to touch briefly on fellowships. Fellowships are essentially, they come after residency programs and they allow you to be like a sub specialist. So for example, we talked about doing an orthopedics residency. Some people may go on to do a pediatric fellowship. So essentially, if you're residency and fellowship trained, you have your BOC certification and licensure, you do a residency in orthopedics, and then you do a fellowship in pediatrics. So when you got done, you would be the person that specializes in orthopedics in the pediatric population. People, you'll see doctors, this is not quite as common in athletic training, but they go on to do multiple fellowships, right? So you could do a second fellowship if you so choose. In hand, right? And at that point, you would be the specialist in pediatric hand surgery, right? And you could see how you could get increasingly more subspecialized if that was something you're interested in. So it'd be really interesting to see somebody specialized to me in prevention and wellness, and then perhaps they focused in industrial athletes, and then maybe they focused on, construction industrial athletes, and et cetera. So it'll be really cool to see how our profession takes this moving forward. But these are options to consider for individuals that may want to build a longer career advancement path in the industrial setting. So lastly, we'll talk a little bit about doctoral education. Again, I'm not going to focus too much on the PhD or the EDD. These are primarily for individuals that, EDD being individuals that want to go into academia or that want to perform research specific to education. So most individuals go that route solely for that purpose. The PhD is the be-all, end-all to doctoral education, and it's really for individuals that want to be able to independently do research that generates new knowledge, right? They're not summarizing research. For the most part, they're doing traditional experiments and generating new knowledge. So there's absolutely a place for PhDs in industry, but for the most part, I think the DAT is a very suitable option for individuals looking into doctoral education within the field of athletic training. And I say that because it really is for the individual who wants to advance their clinical skills, but not in the way of a residency and fellowship, more in a way of taking a leadership role where you're starting to problem solve and you're starting to engage in clinical and administrative decision making that improves the workplace or the practice setting in which you work in. And that's really the goal of the DAT, and it makes a lot of sense for the industrial athletic trainer. So just to kind of wrap up by talking about DATs, like the post-professional master's degree, DATs are not accredited. At one point they were, but they are no longer accredited. So they're all essentially created equal in terms of quality standards. This is a professional doctorate. Some people call it a clinical doctorate, but really it's meant to refer to advanced practice leadership. There are currently 6, if not 7 DAT programs across the country. They are significantly different from each program. So because they have their own autonomy, most of them focus on particular areas. So some may focus on entrepreneurship, some may focus on education, some focus on manual therapy. So being very, again, cognizant of what you want to improve, assessing your weaknesses, and thinking about where you want your career advancement to go will be very important in deciding which program you choose. Essentially, these are perfect for individuals that have some sort of practice experience, even if that's only a year or two. They're in a position where they can influence their system, which I think uniquely industrial athletic trainers have a lot of influence on the system in their workplace. You really want to be an individual that has a growth mindset and understands what the doctor of athletic training degree is trying to do to push the profession forward. And I do think it requires a bit of practice or intellectual curiosity. So on that note, I kind of want to finish up and talk again about relevancy. So we ran through some things that allowed you to assess your weaknesses in clinical practice, right? And that is important for every athletic trainer to know, right? We talked about some post-professional pathways, things like residencies and fellowships, things like a PhD or a DAT that are going to obviously enhance your knowledge. They're going to enhance your leadership, but ideally, like, are they relevant to the industrial setting? We've already said that you guys have different patients, you have different systems, and you have different knowledge and skills. So what are your options when you're in athletic training to better yourself and put yourself in a position for career advancement? So I kind of pulled out 4 or 5 skills that I think are going to be really important to the advancement of our profession and can align really nicely with the industrial setting. And I think these are things that you can find within post-professional pathways, specifically the DAT, as well as in some of the newer methods of continuing education. So first and foremost, we all hear, I mean, it was a bit of a buzzword when we talk about evidence-based practice, but how does that relate to the industrial athletic trainer specifically? So I think it's important for you guys because it's going to enable your clinical decision-making process in a way that's going to integrate clinical experience both in the industrial setting as well as in other settings. It's going to incorporate your patient values, and then it's going to look at the best available evidence. And really, evidence-based practice, right, is important for every setting because ultimately what we're trying to do is improve patient care and patient outcomes. So if we get some continuing education and evidence-based practice, whatever modality we choose, it's really going to allow us to frame clinical questions that are going to allow us to make better clinical decisions. And that's, again, important for every athletic trainer in every setting. Again, it's going to improve our ability to really look at the literature. So it's going to allow us to learn how to search the literature better, which I think is really important, again, when there's a lack of literature that applies to your clinical setting and your patients. We have to get a little bit better with learning how to be descriptive in our searching of the literature and our appraisal of the literature to make sure that it makes sense for our patient, right? There's plenty of articles on chronic injuries, overuse injuries, upper body injuries, but can we look as an industrial athletic trainers and appraise that literature to make sure that the findings of that article match our patient and not just the traditional football player, or the person, the geriatric patient, right? We want to make sure that's applicable for your setting and your patients. And then it's going to allow us to better be able to apply that evidence to clinical practice. And then we talked a lot about you guys generating extra avenues for continuing education. So I think the stronger that you get in evidence-based practice, it's going to allow you guys to analyze your own practice in a way that you can create case studies, not that you can't already, right? But it's going to better prepare you for case studies. It's going to better prepare you to do to submit for presentation at some of our local and our regional and our national conferences, so that we can really start getting the data about your patients from your settings out into the greater public. So by getting a stronger base and evidence-based practice, it's going to help you give us professional development specific to your setting. Quality improvement. So again, this was one that you guys saw. There's some quality QI projects for the BOC. So again, that's 10 CEUs. So we offer ways to get better in quality improvement there. And then quality improvement is a pretty big focus. It's now on the new 2020 KD standards, and it's a big focus in a lot of the DAT programs, regardless of which ones you choose. So when we think about quality improvement, it's going to allow us to understand the real process of quality improvement as it relates to improving our patient outcomes, improving our system performance, which is really important in an industrial setting, and then also improving our own professional development. So it's going to allow you to fuel your own growth, fuel your own outcomes, and then increase the safety of the patients within your workplace. So more specifically, when we talk about quality improvement, at least at ATSU, we teach the Plan, Do, Study, Act model. So the PDSA, you guys have probably seen that, I'm sure, in an industrial meeting somewhere. But by getting really better at the QI process, it's going to allow us to create and manage interprofessional teams. And I know this is something that you guys, it's pretty natural to the industrial athletic trainer to work interprofessionally because of the type of individuals that you work with. But I think it's going to enable us to do that process a lot better. It's going to allow us to take a more critical eye to the issues in your setting that need improvement. It's going to improve your own literacy as well as the literacy of that QI team and that interprofessional team around the systems and the processes that happen in your environment, how to better understand those, and then determine what you need to improve, study that, and then act on it. We're going to, in this process, within the process of quality improvement, you're going to have to collect data that we can track and measure, which many of you do already. And then ideally, it's going to help you implement change. So it's really going to give you a framework for making positive change. And I think that's important everywhere, but particularly important in your setting. So patient-rated outcome measures is another thing that is, you're going to find a lot in continuing education, and particularly in post-professional pathways. Obviously, it's important to look at patient outcomes. I think we already know that, but it's really going to allow you to figure out how to use the tools of measuring patient outcomes and then incorporate them into your clinical practice. Not only so that you can treat your patients better, but also so that you can objectively demonstrate things to your admin. And I wouldn't be surprised if a lot of you guys are ahead of the curve at using these. But the better we get at them, the more natural they become, the more they facilitate our patient-rated care. The more they hold us accountable. So I think I've said that many times, being able to hold ourselves accountable to the effectiveness of our treatments and the decisions that we make around our treatments. And then again, really being able to objectively show that the work that you are doing is helping your employees at your industry. And that always equals value, and that always equals career advancement. If you can make yourself valuable by proving that you do a good job at what you do, it increases your value and then your opportunities for promotion and advancement within the profession and within your industry. And then lastly, the biggest skill for me is health information technology. So why is it important? I think this is huge for you guys. It's going to improve your use of electronic health records that you use to manage patient information, to collect and leverage data, and then to ease your compliance with industry-specific regulations, including things like OSHA. So really strengthening your knowledge, not just around EMRs. When I say health information technology, I don't want to limit that just to the use of EMRs, but this is going to be things like telehealth, electronic health records, any type of spreadsheets that you're using to collect data on other items there, any scanners that you're using, any QR codes, all of the tech that we're using within our facilities that help us inform patient care and the practice of the systems that we work in. Again, in your setting, for prevention and wellness, is going to help us identify potential risks. It's going to help us collaborate across disciplines. It's going to recognize the issues that we need to put into that quality improvement cycle. It's going to help us collect the data that we need to track and measure the improvement within our quality cycle, and then ultimately help us implement change. And again, it's going to show your value, which ultimately translates into your employer. So I think we're like right on time. I just want to leave you guys with some conclusions. So we know that there's a variety of continuing education and professional development options for athletic training within our professional. So we know that it's most valuable when it's relevant to you guys. So we really need you guys, everybody, to kind of sit down, reflect, assess their needs, whether subjectively or objectively, and then commit to some type of structured plan that can fill the gaps that you have specifically to the industrial setting, but then also push you towards that proficiency and that expertise. I really can't emphasize enough focusing on the areas of evidence-based practice, quality improvement, patient-rated outcome measures, and health information technology. I think by improving your skills in these areas, it's going to help you to demonstrate your value as well as the value of the athletic trainer as a whole within our profession. And then lastly, my last soapbox plugs, please utilize the opportunity to perform and present and publish research. It can be case study research. It can be any type of research. It can be any type of presentation regarding what you're seeing in the industrial setting. We really, really need you to do that. And I personally am more than happy to collaborate on any ideas that you have. Boom.